So today we'll be talking about anterior knee, and as I told in the beginning, we will be talking about only the basic things. And just those who are very new, this class is for them. Already we discussed that part. So coming back, anterior knee, reviewing the patella, and we are having the lateral condyle, we are having the medial condyle, and the tibia, the meniscus, and we can see the anterior cruciate ligament from anteriorly as well. I'm just showing some of those important areas which we'll be demonstrating during our scanning period. And here also we can see this is again very important part when we'll be demonstrating the anterior cruciate ligament. That time we'll be talking these things, that the anterior cruciate ligament take its origin from the tibia just below the transverse ligament. This is the transverse ligament, or also called the intertransverse ligament, and below that the ACL starts and goes to the inner side of the lateral condyle. So when we are going to identify the anterior cruciate ligament, very important to see the intermeniscal transverse ligament. So it has different name: intermeniscal transverse ligament, only transverse ligament, or intertransverse ligament. There are three names for the same ligament. So this is the first step. So this is the, we also call the home page. So we are holding the probe like this, the long axis. One end is towards the patella, this side. Aspect marker is proximally. So this side is the aspect marker. And when we are holding the probe like this, what we can see here is this is patella and this is your femur. So this is your suprapatellar fat pad. This is your quadriceps tendon. So if you're coming from above, so skin subcutaneous tissue and then the quadriceps fibrillar pattern quadriceps tendon. Below the quadriceps tendon, just proximal to the patella is your suprapatellar fat pad. Then comes, if you're coming like this, is your suprapatellar recess. Then comes prefemoral fat pad little bit. And here there is a very thin layer of muscle we call this articularis genu. So there are the few layers one by one. And when we'll be starting scanning here, long axis here, over the patella, just when you will be sleeping, what will be sleeping, what will be seeing, that after the quadriceps, there will be very thick suprapatellar fat pad, and there will be very thin the suprapatellar recess, and there will be the bone. The prefemoral fat pad will not be able to see here unless we are going more proximally. So when you will be going more proximally, taking the probe more proximally, so what will happen? So we will be gradually seeing that the suprapatellar fat pad is thickness is reduced, and the prefemoral fat pad thickness is starting, and articularis genu muscle is starting. So keep this picture in your mind. This is very, very important picture when you are doing the long axis scanning. And then when you are doing so this is another, here it is not labeled. So this is patella, this is your suprapatellar fat pad, then your synovial recess, this is your prefemoral fat pad, then articularis genu muscle, and then your patella, femur, sorry. And if you're having the transverse scanning, so what we are going to see here in the transverse scanning. So transverse scanning after the quadriceps tendon. So what I was discussing, immediately after the quadriceps tendons, we will be having the suprapatellar fat pad. So this will be your suprapatellar fat pad. Then will be coming your recess, suprapatellar recess. Then will be coming is the prefemoral fat pad, and just below a thin layer of the muscle, which is your articularis genu muscles. If we are going, this side is the lateral side. Lateral side might be seeing depending on how you are holding the probe, a small amount of the vastus lateralis. So they are the structures when you are putting our probe transversely, they are the structures layer by layer we'll be trying to identify. So this is here again, you can see after this the quadriceps tendon, then is the suprapatellar fat pad, then your thin layer of the recess, then your prefemoral fat pad, then a small layer of the articularis genu muscles. If you are coming here, this is the vastus lateralis, this is your iliotibial band, and here will be the biceps femoris muscle. And if you are going little more proximally, then we'll be seeing these four quadriceps muscles very nicely. We also call it figure of 8. It's like a figure of 8. Most superficially is your rectus femoris. Just below is your vastus intermedius, vastus lateralis, and vastus medialis, and below is your femoral bone. And if you are scanning with the knee flexed, just above the patella. Then we can see cartilage, articular cartilage very nicely. So what are the structures here? You can see the prefemoral fat pad and then the thick layer of cartilage. And this cartilage is very important. The thickness of the cartilage will be reduced if the patient is suffering from the osteoarthritis knee. Now, if we are holding the probe longitudinally with the knee flexed, so this is again very important to identify the few of the important structures. So here, this side is your patella. This is your tibia. This is your the patellar tendon. All of you know that the quadriceps tendon after the patella, it becomes the patellar tendon or patellar ligament. So the patellar tendon, patellar ligament from the patella till the tibia. This is your patellar ligament. This is your Hopper's fat pad. Hopper's fat pad, I'll be showing you there are two layers, superficial layer and the deeper layer. So as a whole, this is your Hopper's fat pad. And if we are going looking down a little bit, we'll be able to see a very bright hyperechoic the structures, which is your intertransverse ligament. So intertransverse ligament in cross section. So intertransverse ligament in the cross section, normally it lies from the skin approximately 2 centimeters below, and just below and posterior, the anterior cruciate ligament starts and goes. Looks hypoechoic, bounded by 1 or 2 hyperechoic line, and your knee should be maximally flexed. And here there is a small bursa. Just above the patella is your prepatellar bursa, and there are 2 infrapatellar bursa. One is above the tendon, another is below the tendon. So it is called the superficial intrapatellar bursa, and this is called deep intrapatellar bursa. So this part is your Hopper's fat pad, and this bright white is your cross section of the intertransverse ligament, and it comes approximately 2 centimeters. Here you can see it, 2 centimeters. So this is approximately 2 centimeters, and this hypoechoic, which some small lines of the hyperechoic, this is your anterior cruciate ligament. It is a very bulky ligament. From here to here is whole is your anterior cruciate ligament. So anterior cruciate ligament lies below and the posterior to the intertransverse ligament. So now, if you are looking this in a transverse section, then what will be seen? So this is your tendon, and then your this is your intertransverse ligament by the transverse sections, and here this is a starting point of the anterior cruciate ligament. So this is the structure. This is your ACL. This is your patellar tendon or ligament. This area, this bounded by 2 hyperechoic line, this is your intertransverse ligament. And below the intertransverse ligament, this is your anterior cruciate ligament. So now, another very important scanning is your looking about the patellar cartilage. If you're holding the probe just below the patella, both on the medial side as well as the lateral side, we'll be able to see these things. So this is the bone, patellar bone. This is your the cartilage, and here you'll be seeing this is your vastus medialis muscle, and this is your 2 ligaments. Vastus medialis muscle is continuous with the medial retinaculum, and below that is your patellofemoral ligament. After that, there is a fat pad. After that, there is the articular cartilage of the patella, and then patellar bone. Here, one very important thing is that this is your quadriceps tendon. If you are holding it from the medial to the lateral, I'll be showing you how we are holding the probe here. The probe position picture is not there. But what is important here, the synovial sac bulges both above and below the patella, and it comes here in this space below the patellar retinaculum and the patellofemoral ligament. And this is one of the very important area where the synovial sac bulges out just below these 2 ligaments. And it is very easy to puncture there, and you can go aspirate or go intraarticular injection, intersynovial injections. I'll be showing you a small video there. So this was the positions. We are holding the probe longitudinally over the undersurface of the patella, either medially or laterally. This is from the medial side. The synovial sac is more close on the lateral side towards the skin. So it is better if you wish to puncture the synovial, go into the synovial sac, it is better to go from the lateral side, not from the medial side. So here what I was showing, this is your vastus medialis, which is continuous as the retinaculum. Here it is medial retinaculum, then your ligament, and then is your fat pad, then your articular cartilage of the patella, and this is your patellar bone. And here one, and here one, the synovial sac will be bulging on the either side. So here, a small video. So see, this is the probe position. You can hold the probe between the condyle and the patella. This is on the medial lateral side. It can be doing on the medial side. And very important is you ask your assistant to push the patella towards you, towards the probe, and show that the group between the condyle and the patella will be increasing, and you'll be able to see that structure. So what I was showing you, the probe position was this one. So here the probe, if you are having the probe positions, we are going to get this picture. So this small video. So this was the patella, and this is your synovial sac bulging just above the patella. This was patella, this was the articular cartilage of the patella, this was the fat. And here, just after the skin, this was the vastus lateralis muscle. After that, that is being continuous with the retinaculum and patellofemoral ligament. These are the only two structures. That means this is very superficial, and we can be very easily. I'm just fast forwarding this video, so we can very easily go there, reach there, just puncturing this two layer. And you might be remembering the most of the orthopedic surgeons, when they do this blindly, they use these two approach. Just lateral side above the patella or below the patella, because here the synovial sac bulges. If I'm putting our probe here, starting from the patella, it's trying to understand all the structures one by one from the patella. So from above, it is your after the quadriceps tendon, we are having just above, proximal to the patella is your suprapatellar fat pad, then is your recess, then your the prefemoral fat pad and articularis genus. So now, if I am holding the probe in the transverse, and our aspect marker is on the left side of the screen, so then what we can see on the, let me freeze it here. So what can we see here? So so okay, so this is your vastus medialis. This is your quadriceps tendon. After that, there is a small layer of your suprapatellar, suprapatellar fat pad. Then is your recess, and then is your prefemoral fat pad, and then is your articularis genus muscle. So they are layer by layer. If you are going little more on the lateral side, so what was important, what I was telling during my PPT also, so if I'm going more proximally, then the prefemoral fat pad will be thicker and the recess will be very closer to the bone. And if you are going more proximally, you see how am I moving my probe. If I'm going more proximally, then what will happen? The recess will be going up and the prefemoral fat pad will be thinner just below your quadriceps tendon. And if you are going laterally here, we can see few other structures what I was discussing is the vastus lateralis muscles, as well as which is becoming the retinaculum, and then below that we are having the iliotibial band also. So this is your femur, this is your vastus lateralis muscles, and this is your iliotibial band, and below that, which is not seen nicely, is your biceps femoris muscle. If you are going more superficially here, the figure of 8 on the middle of the screen, we can see the rectus femoris. On the right hand side, our aspect marker is on the left side. Right hand side, vastus medialis, vastus lateralis, and vastus intermedialis. And we can see all the 4 quadriceps muscles here. So now I will be making the knee extended. So the extended knee, if I'm coming below, then what are the structures you can see here? Let me freeze and let me explain. So this is your tibia. This is your patella. This part is the patellar tendon. And look at here. So here, this is your femur. After the femur, there is a hypoechoic area that is your articular cartilage. So this part is your articular cartilage. After that is
this area, this is a deeper layer of the half pad. And this layer, you see, this is very uniform. Whereas the superficial layer, this layer, are all heterogeneous, not uniform. And many times we make a mistake that there is a, this is ACL. So ACL I'll be showing you. So here, when the knee is fully extended, this is the superficial layer of the half pad. This is the deeper layer of the half pad. And remember, the deeper layer is very important, which takes load. And this is your femur, this is your tibia. Here, it will be your deep interpatellar bursa, and here will be the superficial interpatellar bursa. Knee is fully flexed. Okay, knee is fully flexed, and I'm holding it in the long axis. And now this is very nicely seen. So, how you can see here, this bright white, this is your intertransverse ligament, and this is your ACL. ACL, normally I told you from the skin, the depth will be approximately 2 centimeter from the skin. Maybe little bit less or little bit less or little bit more, but it will be approximately 2 centimeter. So what is very important to identify the ACL, we have to identify the intertransverse ligament. So now we can see the intertransverse ligament also in the short axis. What I have shown you here earlier also. So here, this is your tibia. This is the area from where the ACL is starting, and this anterior area is your intertransverse ligament. And above that, what you can see here is the patellar tendon ligament. And in between, we are having the half pad. So this is when we are flexing the knee fully. So now another thing what I'll be telling, what I was showing you in the video also, there is one way to see the patellar cartilage, as well as there is some recess through which we can inject another very simple, easy technique. So when you are holding the probe here, see how I am holding the probe? I'm holding the probe between the patellar and femur, medial femur. I'm holding the probe like this, and then finish. So you see how I'm holding it. My probe is between the on the medial side, between the patella and the femoral condyle. So what you can see here, this muscle is your vastus medialis muscle, which is being continuous as the medial retinaculum. Below that is your patellofemoral ligament. This is your patellar bone, and this part is your cartilage, looking black, and this white area is your adipose tissue. So now, from the medial side, we'll be again looking for the same. We will be able to see the same thing, but medial side, as I told you, because again I'm showing you. So this is a picture. So just you can see the structure. Yes. So vastus medialis, you can see the retinaculum, you can see the patellofemoral ligament. After that, fat. After that, the cartilage, and then we are having the patella. And if we are holding the probe same way, but from the lateral side, holding the or pushing the patella from medial to lateral side, my aspect marker is cranially. So here, the synovial side, you have seen this patient don't have much of fluid. This patient don't have any effusion. But here, when I'm pushing it like this, you see the synovial sac bulges out both above and below it. So, can you see it? Okay, so what you can see here, this is your patella, like the medial side. This is the articular cartilage. This is the adipose tissue. But what is important from here, this is inferior side, and this is the superior side. So here, in both the sides, the synovial sac bulges out, and that is the area where we can give the intraarticular injections to the side. So that video I have shown. I will be posting that video in your YouTube channel also. Please go through that video. And remember, earlier days when the orthopedic surgeon, even nowadays, when the orthopedic surgeon used to give injections, you know what they used to do blindly? They used to give here and here, above the patella and below the patella, here or here. So that is fine because the synovial sac is very superficial to that. What is there between the synovial sac and skin? Only the retinaculum and the patellofemoral ligament. So that is the reason why if we are putting the probe there, we can see the, again let me unpreach and let me clear the drawings. So if I'm holding the probe here, just you can see that the synovial sac is bulging below the patella and above the patella as well. So this is another very important importance for this pathologically, that this thickness of this articular cartilage of the patella will be reduced if somebody is having the patellofemoral osteoarthritis. So okay, for this much today, if you have any